HIV/AIDS affects approximately 45 million people worldwide, and nowhere more so than sub-Saharan Africa, where the virus is most prevalent. South Africa, Africa's richest country, is home to the world's largest population living with HIV, a staggering 5.6 million people based on data in 2008. Combining national healthcare, NGO planning and implementation, together with the aid of international funding, Broadreach Healthcare, in tandem with the Mpumalanga Department of Health, is taking the HIV/AIDS pandemic head-on.
It's time that in public health we begin to tackle issues like HIV with interventions that are at the same magnitude as the disease burden that we have.
In response to this need for a different method of combating HIV and AIDS, the I Live campaign was launched with a view to testing an entire sub-district of a municipality. The area earmarked for this pioneering initiative is the Mpumalanga municipality of remote Dipaleseng in the northeast of South Africa. The project was kicked off at Siyathemba Stadium in one of the municipality's townships, with a massive testing drive encouraging people to undertake a general wellness assessment and VCT testing for HIV. Patients found to be HIV positive are monitored by private healthcare partner Kaelo Consulting. They are then referred to a regional healthcare center of their choice, where they receive treatment education on how best to manage their condition, are continually assessed by doctors, and receive medication from the in-house pharmacy.
These initiatives, they could never be pulled off by a company like Broadreach alone. We've always ascribed to a philosophy that using what exists is the most important first step when you try to launch programs and implement them. And therefore, we always look to find effective partners such that together we can form a team that is big enough to tackle the problem at scale. This is another example in the way we're approaching this particular initiative of how we try and leverage what exists already. By partnering with a partner like Kaelo, who are a private sector company, who have established experience and capacity in doing testing, by partnering with government who have the facilities, the scale, the access to community health workers, access to the individuals who we need to get to, by partnering with the community who in themselves are a system, and by adding then our expertise, we have come up in essence with a team that could actually manage pulling off district-wide testing at scale.